chapter 5. Begins on page 111. On the left, you'll see the slides. It's talking about maternal risk factors. So this chapter is entitled Promoting a Healthy Pregnancy. It's talking about choosing a provider. Let's go down. What you need to look for when it comes to midwives and OBGYNs, preconception care, so even before you decide to get pregnant, making sure you're taking care of yourself, and then the prenatal care. There's some bullet points here that are important. Just make sure you read through those, what goals you need to set as a patient or have your patients to set, and the counseling items. So dentist, even genetic counseling, STIs, STDs, medications, vaccinations, your first prenatal visit. Now let's look at page 115. It's talking about the pregnancy classification system. And we're going to go over this in class as well, but it's something that's called GT-PAL, okay? So if you see GT-PAL, which is here, okay, it's recording the pregnancies and their outcome, okay? So gravida is the total amount of times that you've been pregnant, okay? Including your pregnancy now as a patient. The T is the number of term pregnancies. So term is anywhere from 37 weeks to 41 and 6 days. P is anywhere from 20 weeks to 36 and 6 days. 36 weeks and 6 days. A, the number of abortions, including spontaneous and induced, is anything up to 19 weeks and 6 days. So right at 20 weeks, okay? And then L is the number of living children. That includes twins, triplets, babies that survived that were born at 26 weeks, whatever amount of living children they have, okay? And we'll work through some of this in class. But it's important. This is a wink and lollipop. You need to know this and everything that I just said, okay? All right. Family history is important to know, and we'll talk about old CARTS, OLD, CARTS later on, but that's part of that history, okay? Environmental health assessment, making sure that they have what they need during the pregnancy. Where do they live? Do they have running water? Do they have food? Do they have AC and heat? Social history, tobacco use, alcohol use, cannabis, cocaine. There's a wink and lollipop for the cocaine, so make sure you know this paragraph. What is the biggest risk of abruptio placentae? And that would be the use of cocaine, okay? Exposure to STIs, STDs, you're going to hear that interchangeably. Make sure that you understand that. Let's go back to alcohol up here. There is no safe amount of alcohol determined. Wink and lollipop again. There's no safe amount of alcohol. It's not okay to drink 1 glass of wine. It's not okay to drink 1 beer, okay? There is no safe amount of alcohol. Genetic testing. So this is something, especially if there's a family history of a congenital anomaly, such as Down syndrome or Marfan syndrome, anything, they need to be referred to a genetic specialist, okay? It's very important that they have that screening done. Okay, so Wink and Lollipop, if they have anything come back positive on their genetic screening, they need to be meeting with a genetic specialist. Optimizing outcomes, prenatal genetic testing, make sure you read through this. Make sure you understand the genetic screenings during pregnancy. Sickle cell, Tay-Sachs disease, thalassemia, hemophilia, the G6PD, cystic fibrosis. Okay, these are some of the ones. Sickle cell can cause spontaneous abortion, okay, which is aka a miscarriage. And then some of the risk factors are listed over here. Again, prenatal physical examination. So what are they going to do? They're going to do a pelvic exam. They're going to figure out the gestational age, and we'll talk about that, how they do that. Fetal heart tones, fundal height, vital signs, of course, and weight. The first screening is usually the longest, and then after that, when they go, it's a quicker visit. Page 119 just goes through the different focus exam. Reading through that, just make sure you read through. This is showing the how to measure the fundal height, the uterine size, the fetal position. You measure from the symphysis pubis on up into the top of the fundus, which is the top of the uterus. Okay. On page 122, it's showing you the different heart tone positions. Okay, so let's go here. Same picture. This is just showing, and it's based on the position of the baby, the fetus. Okay, so RSA is right sacrum anterior, and you'll see the different meanings of those. Okay. Sacrum we know is what? The buttocks area. Okay. Occiput posterior, that's the back of the head. The mentum is the chin. Okay. We'll talk about more about this later, but just be familiar with this. Is how you get the fetal heart tones. Okay. Based on the positions here, you find where the heart would be heard the best. Okay. This is just showing vaginal exams, speculums. Okay, so inserting the speculum, and then we're going to look on page 124 at the cervix. Okay, in the same picture, 124. This is a cervix. Picture A is a cervix of a nulliparous. That means that no baby has come out of this cervix. Okay, it's still shaped like a pinpoint, an O, and then B is a slit. This means there's been a fetus baby born out of this cervix. Okay, it's a slit shape, multiparous. Okay, so nulla is going to look like this. When it's a slit, that means it's been opened, it's been dilated, it's had a birth come out of it. So make sure you understand that. And this is just showing the exams. This chart on page 125 is talking about the different subsequent exams, what they would include, maternal well-being, fetal well-being, what we're going to check. So to understand that, make sure you read through this screening, this chart. Okay. The labs are listed on the same page, or actually page 126. And then you have nutrition. And then this chart here is on page 127. Okay, it's just the different types of laboratory tests that will be done per trimester. And if you'll reference page 138 as well, I'm not going to flip there, but on page 138, it's talking about the, it's per trimester. It's lined up, like which ones are per trimester, and not just them in order like this, in alphabetical order. But either one, they're both the same. It's just a different order. On page 127, for the labs, let's go back up. It's talking about the problems that can occur when the woman is Rh negative and Rh positive. And we'll talk more about that Rh negative factor and the ROGAM shot later on. But you do need to be familiar with this paragraph right here. This is a wink and lollipop, okay? So make sure you know these prenatal labs, this paragraph, okay? It's talking about rubella. It's talking about the Rh negative here. So make sure you understand that. Let's see. If the screening is negative, then for rubella, then the woman, of course, is advised to stay away from anybody that has rubella. If she is not immune, then a positive would be immunity, and a negative would be that she's not immune. And she cannot get the rubella vaccine during pregnancy. She would have to wait until she delivers, and that's something that we do within the first 24, 48 hours postpartum, is we give her that rubella immunization if she was non-immune. You'll see that on report sheets when we go to clinicals, beside rubella, NI or I, and that's non-immune or immune. And we know that she's not immune, then we need her consent to give her that rubella immunization, the vaccine. So, but just know that we must advise these patients to stay away from anybody or any child that could possibly have rubella, because it can cause a fetal demise, okay? I think this is the one that's the first, second, and third trimester, the pictures. And this is the one that's on page 138, I think. Yeah, this is one, so you can flip there and you'll see this chart right here. Okay. It starts talking about more nutrition, calories, water intake, multivitamins, prenatal vitamins. Make sure that they're taking their prenatal vitamin, of course. If it makes them sick, then they can take it at night. You know, some people try taking it with food. It still makes them sick because of the nausea, vomiting that comes with the hormonal changes during pregnancy. But a lot of patients, and even I have found that when I was pregnant, taking it at night really made such a huge difference. Okay. Iron and vitamin C is important. There's increase in blood during pregnancy, but there also can be some anemia that happens. And I know that makes sense. If there's more blood, there should be not anemic, but the nutrition deficits. So make sure that they understand they're eating enough, they're consuming proteins as they should. Iron is important. So this paragraph again is a wink and lollipop. Okay, you should know that vitamin C, ascorbic acid, helps absorb the iron. So when we are giving iron tablets in clinicals for postpartum women, what are we going to serve with that? Okay, orange juice, right? We're going to bring orange juice with our medications before we pass the medications. Okay, if they have any type of prenatal vitamin or iron supplement. We usually, if their hemoglobin is greater than 10, we may hold the iron because they won't really need it. It won't absorb, as it's really just not necessary. If it's less than 10, then we always give it. Okay. Folic acid, let's talk about that. Of course, it is a water-soluble vitamin. During pregnancy, we need a minimum of 800 micrograms per day. Okay. So a lot of times that they'll just take another 4 micrograms or 0.4 milligrams of folic acid daily. But I always have told my patients, if you take 1 milligram, it's not going to hurt you. You're not going to overdose on folic acid. Okay. This prevents neural tube defects, spina bifida, cleft lip, encephaly. So any patient in the childbearing age, okay, if you can get pregnant, whether you plan to get pregnant or not, if you're in a childbearing age, you need to be taking folic acid. And a lot of times it is in a multivitamin. Because if you do get pregnant and you have a lack of folic acid, what can it cause? It can cause the neural tube defects, okay? Not saying that you did anything on purpose or, didn't know, but this is why education to our patients are so important, okay? Let's go talk about foodborne illness, all right? Listeriosis, it's a real thing. It can make you very, very sick. Foodborne illness, bacteria, it can cause negative outcomes. It can cause spontaneous abortions, preterm births. So we want to make sure that our pregnant patients know not to be eating anything, and this is a wink and lollipop, anything that can be susceptible to this listeriosis, okay? Anything that can hold that bacteria, okay? So this is found in raw, unpasteurized dairy products, milk, cheese, unpasteurized, okay? Not saying that they can't eat milk, cheese, and yogurt. They just can't have the unpasteurized, okay? They can't have raw eggs. They can't have deli meats. They can't have hot dogs that are not heated, okay? Food properly stored at 40 degrees Fahrenheit or below, or any prepared food that has been sitting in the refrigerator leftovers over 4 days, they should not be eating. Wink and lollipop, that paragraph, okay? Hand hygiene, let's talk about this. So, food practices, safety, make sure that they understand this is so important. Wash their fruits and vegetables, avoid smoked meats, so no raw oysters, no smoked salmon. Like, they need to stay away from all of this during their pregnancy, okay? And what do you see in this right here? You see a wink and a lollipop. So, do you think this is important? Absolutely, it's important, okay? Same paragraph. This is on page 130 in your book. Weight gain during pregnancy. So there's a chart in your book on page 131 that talks about underweight, normal weight, overweight, obese, and what their BMI is, how much recommended weight they should gain during the pregnancy. So if you have a patient that has a BMI over 30, then they only need to gain about 11 to 20 pounds during their pregnancy. Now, if you have somebody that's underweight that has a BMI less than 18.5, then they can gain up to 40 pounds and still be okay. It's just, we don't want them gaining too much and, being susceptible to diabetes or anything during the pregnancy, because it can make it worse. Planning daily food intakes. It talks about prenatal care after bariatric surgery. And then it starts talking about different factors of nutrition during pregnancy. Okay, there is something, and there's that chart that's in the book about the weight gain. Okay, there's something called pica, and you may have seen this or heard of it. This is a consumption of non-nutritious foods during pregnancy. Okay, it's a craving they have. It may be eating cornstarch or flour, crunching on ice, chewing on Play-Doh, even I've seen. And this is something that happens when there is a deficiency in vitamins. Okay, we had a patient that brought her jar of cornstarch to the hospital, and we convinced her to throw it away, and then we came back the next morning and she had another brand new jar of it, just saying that she had to have it. So it's a craving. It's not really sensible, but it's real. So you can read about that on page 132. On 133, it starts talking about exercising, travel, work during pregnancy. It's okay to exercise. Okay, it's not prohibited. If somebody's been running, they're an athlete, they've been running, it's okay to continue running. Okay, they don't have to stop anything. So another wink and lollipop is that they can continue doing what they're supposed to do. So this paragraph on exercise, another wink and lollipop. Okay, it will actually lower the risk of gestational diabetes. Okay, exercise is not contraindicated for a gestational diabetic patient. And we know gestational diabetes means what? That you only have the diabetes during pregnancy. So you were not a diabetic before. You will not be a diabetic. Hopefully you won't be a diabetic after. But you have been diagnosed with gestational diabetes. So that's checking your sugar, making sure you're eating appropriately. I was gestational diabetic with my first pregnancy. He was 9 pounds 3 ounces, and that had to do with the gestational diabetes. So it was not fun, but I did it and had a healthy baby. Kept my sugars under control. Box 5.2 is talking about muscle strengthening during pregnancy. You can read through this. And then it's talking about the basic prenatal exercises. Okay. In this, on page 134, it's talking about Kegel exercises. Now, Kegel exercises, and this paragraph is a wink and lollipop. Okay, it's talking about are they important during pregnancy? Okay, so we have a pubococcygeal muscle, the PC muscle, and this is when you squeeze it to stop the flow of urine or start it and stop it. It's that muscle. Okay, we can all sit in class and do Kegel exercises and nobody would ever know. It's not like you can look at somebody and tell if they're doing Kegel exercises. Okay, but I found it interesting, an article I found a couple of years ago about do they work? Are they important to do? Okay, and this article here actually proved that they do help. Okay, and I'll pull this up in class, but it does facilitate proper bowel and bladder movements and strengthens that PC muscle. Okay. Rest and work. planning for maternity leave. All this, it goes through. Over-the-counter medications, what is safe, what is not safe. Prescription medicines, make sure you read through that. Any type of herbal or homeopathic medications. And then we have Table 5.5. This is on page 137. Thalidomide, and we're going to talk more about this in class. But thalidomide was a drug that was used in the 60s and 70s in Germany and other places and in the United States. It was banned. It caused seriously fatal, sometimes birth defects, notably shortened limbs, and I'll show you some pictures of that. But make sure that you understand that these are teratogenic medications, okay? The warfarin, isotretinoin, phenytoin, and lithium, okay? And what all that they can cause. And of course, we have the table on page 138 that we talked about a while ago. The prenatal care map, how it's breaking down into the labs that need to be done during the first trimester, second trimester, and third. I like this one better because it kind of goes in order of the trimesters. Okay, so just be very familiar with those. Birth plans, childbirth education, birth plans, talks about on page 140. Lamaze classes, Bradley, hypnotherapy for birthing, and then it's talking about breastfeeding. Okay, so make sure you read through that. Know what a fetal kick count is. Okay, and this is just the mama keeping up with how many times the baby kicked in the hour or 10 minutes or whatever it's set for. Okay, then there's just some summary points for this chapter. And that's the end of chapter 5.